Is the world facing a new viral threat? Oh yes! Hello everyone, welcome back to Press Desk. Today on another episode of Endless Adventure, we'll be diving into an important topic that has been making headlines. Mpox, also known as monkeypox. Now before you start imagining monkeys running wild with spots, let's set the record straight. We'll be discussing everything you need to know about this virus. What exactly is it? How does it spread? And most importantly, how can we protect ourselves from this disease? Do not go anywhere as we're about to break down everything you need to know about this viral infection. First of all, what exactly is Mpox? Mpox is actually caused by the monkeypox virus and it's part of the same family of viruses such as variola, known as smallpox, cowpox, chickenpox, and vacina. But don't worry, it's less deadly. This disease usually causes a rash that can turn into fluid-filled bumps. So, if you ever see someone in a public transportation, neighborhood, or at a social gathering with a weird rash on the skin, it might not just be a bad case of acne. That person might actually be a carrier of Mpox disease. This disease was first discovered in 1958 when two outbreaks occurred in colonies of monkeys kept for research, and you can tell that is where the name came from. The first human case was recorded in 1970 in the Democratic Republic of Congo, and since then it has been in Central and West Africa. On the 14th of August 2024, the Director General of the World Health Organization, Tedros Ghebreyesus, declared Mpox as a public health emergency of international concern, with Africa currently recording 21,466 confirmed cases and 591 deaths in 13 countries.
Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
So today, joining me to discuss in-depthly on the subject matter is a certified health practitioner, Oluwaseun Adereti.
Thank you for having me on your YouTube channel. I'm really glad to be here. So, monkeypox disease, also known as Mpox, is caused by a virus known as monkeypox virus. This was first isolated in monkeys in Germany in 1958. Later on, the first human case it was seen in a 9-month-old baby from Democratic Republic of Congo. And this infection, on some of the symptoms you find is fever, muscle ache, headache, and swollen lymph nodes and characteristic rash, which could graduate to being pus filled. And these symptoms could appear 1 to 24 days post infection. And after, when the person is infected, contacts this virus, and it could last for 2 to 4 weeks. And there could be complications, but these complications is mostly seen in people with weak immune system, pregnant women, and children. Infection could occur when you come in contact with contaminated materials and also from infected animals also. A disease could be declared a public health emergency when it threatens or when it affects a population at a large scale. So this is where interventions occur, just like we saw in COVID-19, whereby there were a lot of restrictions, that were imposed. so as to limit the spread of COVID. So the same way for other disease that could pose public health emergency, that could lead to high mobility and mortality. There are some public health emergency responses that are put in place by the WHO and other health organizations to ensure that the disease does not spread and affects the health and affect the public health. So infected individuals are expected to quarantine once they know that they are they've been infected with monkeypox virus, and they should isolate themselves till when the scabs are falling off and the wounds are healed and fresh layer of skin you know begins to grow, begins to come up. And this is to prevent isolation is very, 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 very key, to prevent the spread of this monkeypox virus, to the population. And just like the case study of COVID-19, whereby the federal government, also tried to intervene in making sure that quarantine measures are put in place, not just educating the public on what to do once they are infected, but also they even went ahead to create centers whereby they can be able to quarantine or isolate individuals that were infected. And they were responsible for their health care, responsible for their feeding, and also their general well-being, pending the time they get better. Okay, the federal government can actually balance funding. I will just give two ways they could do this. Is number one, prioritization. We know that there are a lot of plethora of research to do and the funds are limited. So they could actually prioritize their funding, and give attention to infections that poses great threats to the population, like probably in the sense of it could affect or increase morbidity, mortality, and also there's a possibility of outbreak, large scale outbreak in the population. And the second one is collaboration on a global platform. Now we said the world is a global village, and there are a lot of funding available, even from other countries to help areas whereby there is limited resources, to ensure that there is enough data and that whatever is needed to help research in that area, it's done.
Guys, prevention is key. To protect yourself, avoid close contact with anyone who might be infected with this disease. Wash your hands regularly and don't forget to sanitize commonly touched surfaces. And if at all you are attending any large gathering, try to wear a nose mask, as this can also help. Remember, prevention is better than cure. And that's it for today's video on Mpox. If you found this video very helpful, make sure to give it a thumbs up and hit that subscribe button for more content like this. Stay safe, stay informed, and I'll see you in the next video.